and we just scanned his feet in the back and did an exam, and we found that he's very flat-footed. So if you do have back problems, get it addressed now. Don't wait 15 years. Hello everyone, welcome. Thanks for tuning in to my channel here. So we've got a young man here that came to me for back pain. I see some of his family, but I wanted to shoot a video because I want to show you the possibilities for knee pain. Now he has some left knee pain, correct?
Yes.
Left knee pain, and we just scanned his feet in the back and did an exam, and we found that he's very flat-footed, and his left foot was worse than the right foot, but both feet were flat. So we're going to show you how we adjust the knee using a speeder board. Okay, so I'm going to go ahead and adjust his left knee and then have him stand up just to see how that is afterwards. I'm going to slide this under the foot. Yeah, okay, relax your leg there. So we just pop up the piece here. Again, this is called a speeder board. There's a lot of different ways to adjust the knee. And I can also adjust the tension on this. What I'm doing is I'm adjusting his the head of the tibia from posterior to anterior, because when you flatten your feet, your tibia rotates in and back. So we're going to do the opposite of that. Okay, now I want you to go ahead and stand up on your knee, or just stand up in general. And stand right over there. Just do like a half squat. See how that feels. See if you notice any difference.
Half squat?
Yep. Okay. You notice any difference at all?
Yeah.
How's it feel?
Feels better.
Less tension?
Yeah.
You want to go ahead and walk down the hall and see how it feels?
Yeah.
You had knee pain when you came in today?
A little.
Okay. All right. How's it feel?
Feels good.
Okay, it should feel like there's less pressure on it.
Mm-hmm.
And when
Yeah,
you do
that's what
that
it feels
squat, like it's less pressure on the
Yeah,
front of
yeah.
the knee. Yeah?
Because I've always like that. It's
Oh.
super.
Okay, great. But ultimately, you're going to have the flat feet fixed. Otherwise, it's just going to keep rotating in like that. So
Right.
go ahead and lay down on your stomach. Let's address your lower back. So he had a basketball injury years ago. When he was a kid, he fell really hard on the pavement on his butt. And really has had back pain ever since then. Has never been to a chiropractor before, right?
Mm-hmm.
This is your first chiropractic adjustment?
Yes.
All right, there you go. So there's probably a bunch of you out there watching this video that have never been adjusted. Yeah, chiropractors can help with back pain, but we can also help with shoulders, ankles, wrists, elbows, knees. And we just adjusted this young man's girlfriend, her elbow and her wrist. So it's not just back and neck like a lot of people think. So what I'm doing right now is a little cox flexion distraction technique just for his lower back. How's that feel?
Feels great.
And we're just opening up the space on the discs, L5, S1, L4, L5, really all the discs below my hand. So all his lumbar discs. We're opening up the space in the back of the disc where the nerve exits from the spine. It's called foraminal gapping. So we're just taking pressure off some of the nerves in his lower back. We've done a bunch of videos on cox flexion distraction technique for disc herniations, disc bulges, and spinal stenosis, and failed back surgery. Luckily, he has not had any back surgery. We're gonna avoid that for him. So if you do have back problems, get it addressed now. Don't wait 15 years. Have it looked at, have it addressed. Don't ignore it, okay? Because these things can get worse, and degenerative process can take hold, and then you're dealing with more invasive procedures if it gets too degenerative. So really important, if you have back pain, you know, and you take Advil or something and it goes away, fine. But if that back pain comes back, whether it's a couple months later or a year or two later, it's that same problem you had probably a few years ago. So don't keep medicating it. That's not the answer, and that's not going to fix the problem. It's just going to cover up your symptoms. Okay. All right, we're going to start with your left side up. So lay on your right side, face me. He also gets headaches, so we're gonna fix that and address the headaches. Headaches are real easy for chiropractors to address and fix and get to the bottom of them, so they don't come back ever again. Headaches typically come from tension in the neck. So if you spend a lot of time on your cell phone playing video games or just doing whatever on your phone, there's plenty to do. That's going to increase your likelihood of headaches. So after I adjust you today, try to stay off your phone for 2 to 4 hours afterwards, okay? All right, take a deep breath in and blow all the way out. Good. And the other side up. You all right?
Yeah.
Have that other one up. Okay, and bend this top leg. Okay, take a deep breath in and blow all the way out. Good. And lay on your back. Face up. Okay, cross your arms in front of you. And tuck your chin down. Take a deep breath in. Come on up. Good, and blow out. One more deep breath in. And blow out. Do you have a headache today?
No.
Good. Okay, relax your arms. Okay. Your first neck adjustment. You okay with that?
Mm-hmm.
Yeah, relax here. Good. Much better. Okay. All right, folks, if you're watching this, if you have flat feet and you know that you have flat feet and you get plantar fasciitis on the bottom of your feet and you have knee pain, they're probably related. And if you also have back pain or hip pain, they are probably all related. The feet affect the knees, which affect the lower back. And in his situation, his flat feet are definitely not helping his lower back issue, and his flat feet are also causing his knee pain. So we adjusted that today. We'll probably get some orthotics for him in the next few weeks. If you guys have any questions about flat feet and how that can affect the back or the knees, or if you guys want to see some certain video, certainly comment below. Thanks for tubing in, and thanks for doing a video for us. All right?
No problem.
All right, come on up. Stand up on that knee. Let's see how it feels. And again, do a half a squat for me. Should be a little bit easier now. And bend forward. Touch your toes. Do the best you can. How's that feel? A little bit easier?
Yeah.
Okay. All right.
I never had my back cracked ever.
First time you had your back cracked? Okay. Yeah. And for those of you that wonder what that cracking noise is, it's gas being released from the joint, bouncing off synovial fluid. I did a video on that, on what that cracking noise is. So if you're really interested, just check that video out. Thanks for tubing in.